Yeah, this is Robin from the Back Pain Secret podcast, and today we're going to talk about how to have a difficult back pain conversation, guys. Okay, how to have a difficult back pain conversation. I'm gonna be right back after the intro song. Okay, guys, I'm back, and today's topic is how to have a difficult back pain conversation. Okay, and as always, I have a patient story. We can call this lady Rebecca. This is a made-up name, of course, to protect the innocent. Rebecca she's around 40 years old. She has 2 kids. She's married. She's had a herniated disc. She got the diagnosis about 3 years back, guys. And for 3 years, she's had back pain. And for the last 2 years, the sciatica has gradually gone away. But the last year now, it's taken up again. So down her right leg, she has a constant radiation feeling down her leg, okay? She's trying some exercises. She's doing her core stability exercises. She's doing a bit of walking. But when she's working as a nurse in the hospital, guys, it's hard because she's twisting and turning people in the bed there, and it irritates her back. Externally, when you meet Rebecca, you can straight off you feel like she's a people pleaser. She's a nurse. She likes to nurse people. She likes to make people feel good. She wants to help people. She has a good heart, and that's what she's all about. Contribution, and this is all great. But at the same time, internally, when you talk to Rebecca, after a few times, it was very, very apparent that she felt like people didn't really respect her, and she was also very afraid of conflict. She didn't really want to talk to people and tell them how she felt. She didn't want to say no. It was easier just to go along with whatever they had, But the thing was that this was now creating a conflict with Rebecca because she had this feeling inside, and at the same time, she couldn't really, when she wasn't expressing herself, the back pain in her back increased, specifically the sciatica pain, She was afraid of having these hard talks with people, and afraid also to show people around her how she felt regarding things. And the big thing now, the big nugget was that the back pain was starting to increase every time she decided not to have this difficult conversation. The back pain increased in her back, and specifically the sciatica pain that radiated down her right leg. And then Rebecca hit kind of a wall at work, at the hospital. There was some stuff regarding the schedule, how they should work or whatever, And this schedule was a lot of people involved. And the way it went was that Rebecca didn't really speak up during the meeting there. So what happened was that she actually had the night shifts and stuff, and it ended up she was going to spend 50% less time with her family and her kids, and that really affected her. And she could feel that sitting there in the chair, not speaking up, not telling everyone how she felt and how it would affect her, was really increasing her back pain and the sciatica pain. And she really felt internally like she needed to step up and express, for the other people how she felt, so to protect her family time and also to reduce her back pain. And this is weird, when you have back pain and sciatica and whatever, that there's a psychological aspect also to the back pain always. And in her case, in Rebecca's case, it had a big part, So this was about the time she came to me, and we had the ordinary chat, I was telling her to walk every day, 30 minutes. I was telling her to stand up and do core stability exercises. But as I grew, or as I dig deeper, in the conversation, it was very apparent that the big domino in Rebecca's life to reduce her back pain and her sciatica pain was to start to have hard talks with people, to really tell people how she felt and not just go along with whatever they said. So I told her, you need to stop to being a people pleaser and step up and talk to people and tell them how you feel. Be respectful, but you have to be able to tell people around you how you feel, or else they're not going to be able to know how you feel, okay? And this, what I would say, Rebecca, is your big thing you need to do in your life, in order to reduce your back pain and secure your family time with your kids and husband. So I told her, there's a few things you can think about to have hard conversations, and this is something that I struggle with as well. So this is stuff that I picked up over the years. Meeting 50 or 60 or 70, even 80 patients a week. Sometimes, I had a lot of people, new people I meet in my life, and sometimes I had to have like hard conversations with them. So number one, my tip to having a hard conversation, no matter what, but in this case, back pain, do not enter the conversation with the person in your emotional state, because there's two people in there, so give an example. If you're fired up about something, you feel like this person wronged you, did something, said something, or didn't like treat you with respect and whatever, do not go in the conversation with anger and resentment and hatred and stuff, okay? Because that's just going to mess up the conversation, okay? Very, very important. There's always two people whenever there's a conversation, and each person in the conversation brings something to it, and if you just go in and you're just thinking about and expressing the way you feel, then the conversation is going to be a bad conversation, and neither you or the other person will get what they want, okay? So first rule, don't have a conversation with people if you're really fired up, if you're really angry. Go for a walk, have a drink of water, take a couple of deep breaths, and then go in and have the conversation in a more calmer pace. Also, you like to move into the conversation with humility, okay? And what do I mean with that? What do I mean with humility? There's always two sides to a story. You need to remember that, okay? And whenever you go into a conversation, you never ever know the whole story, okay? And bring kindness to the conversation. This might sound really, really like chicken shit, like you're not expressing yourself. And I'm not talking about that. It's about the end result, Go in with humility. There's always two sides to a story. You don't know the whole story. There's always two sides, and bring kindness into the conversations. That's number one, okay? And number two, begin with the end in mind, There's a book out there called The 7 Habits of Highly Effective People, okay? It's like sold like 10, 12 million copies. Is really, really popular. And it's a concept in there that says, begin with the end in mind. And it's very, very important that before you go in and have this hard conversation, that you go in and you think about, before you go into the conversation, how do you want the other person to feel after the conversation, okay? What do you want them to do or act or say or do? And it's the same thing for you, After the conversation, what do you want to do or say or be different, So if you don't go in the beginning of the conversation with a very clear picture of where you want this conversation to go, the conversation can go like 50, 60, 70 different places, okay? Everyone gets confused, and chances are that you're going to increase the stuff that's going on between the two of you, and you really get more and more irritated, and you might say and do stuff that you don't really mean, okay? So there's like a 3-step process that you can use, okay, that really can't really piss anyone off if you present it in the right manner, okay? So number one, let's say, for example, that you that are watching now, we're having a conversation now, and you did something, it could be whatever it is, and really pissed me off, And my goal in this conversation is that we should resolve this, and if I tell you this in this way, and if I express myself in this way, chances are that we're going to resolve it, or the chance is going to increase much more, okay? So first off, I say to you, I would say like, I saw or heard you do something, okay? I saw or heard you do something, and that we can call that X, okay? And then number two, that's how you feel, okay? I would say, I saw you did and said this, okay? And it made me feel in anger, confused, upset, whatever. We can call that why, okay? And then number 3, you have the request, okay? So you say, can we talk about that, you know? And that's C, can we talk about that? So just to repeat that, you know, first, you tell the person you saw them say something, you heard them say something, or they did something to you, you know, you tell them that. And then number 2, you tell them how that made you feel. It made me feel upset, angry, confused, whatever, okay? And then number 3, you ask them, you know, can we have a chat about this? Can we talk about it, you know? And presenting it in that way, in a calm way, really, I mean, most people will listen to it, you know, and chances are that you're going to be able to resolve this in a good manner. And then also number 4, and this is something that I've worked with quite a bit myself, you know, over the years. You know, I'm 25% Italian. I have 25% Irish blood in me. I'm Canadian and I'm Swedish, okay? And I would say that the Irish and Italian parts of me, you know, growing up, I'm 46 years old now. I was quite like very like hot-headed type A person, you know, but as I grow older, I've calmed down a bit, you know, and I've learned to have more patience with people when it comes to talking to me, you know, and when it comes to people, going slow is fast, okay? Going slow is fast. And this is something that I learned, and usually if you just try to solve people's problems and not really listening to what they're saying, then it just takes a long time to reach the goal, okay? So listen more, talk less. And this is something, I mean, there's something between like women and men as well. A lot of men try to just solve problems all the time, and women have a tendency to they want to feel like they get understood what they're saying, you know. And I say that it's a gender thing, but it's always, it could be like mixed match as well. But something I've learned from my relationship, you know, being married for 20 years, is that whenever my wife has something to say, you know, I had this tendency before to try to solve her problems, just giving solution, and she might like that, you know, but it didn't really, wasn't what she wanted to hear, you know. She more or less just wanted me to hear her out and maybe say, you know, I really understand that's hard for you. You're going through something, you know. She didn't really want me to solve her problem, more or less just be there and listen to her and understand that she was going through something. And this is something that I definitely think everyone that is dealing with people on a day-to-day basis have to be conscious about, you know, because everyone is going through struggles in life, you know. There's some saying that out there, I don't know who said it, you know, that every person that you meet, they're going through a struggle right now, you know. It could be a person that they're struggling with, it could be an illness, it could be something, you know, but everyone has their problems. And it's so easy to judge and be pissed off and think you want to like just hurry them up to get it done, you know. But most of the time, if we just take a step back and listen to them, and we have more patience, then both of us, both you and me, are going to be able to reach the goal quicker and hopefully reduce our back pain as well. Okay, guys, that was today's topic. I'm going to try to be on a bit more, you know. I'm really working on this online course for sciatica, and I actually renamed it now, so it's your sciatica pain solution. Your sciatica pain solution. So if you think that's a good name for a sciatica course, it's a 6-week course, it's online, and it's going to be great. So if you think that's a good name, give me some love, or if you think have a better name, just hit me up there on Facebook, Instagram, or YouTube, wherever you are, you know. But that's the working name. Okay, guys, I will see you guys tomorrow. And guys, remember, you're just one step away from healing your back pain. Bye-bye.